Dr. Balani, welcome to ITV Gold. Thank you so much for giving us your time today.
Thank you for having me again.
Of
Thank
course.
you, Aditi.
Of course. We have you here because I have a lot of questions. So let's go right into it. Big news came from the Surgeon General, Dr. Vivek Murthy, today when he called COVID misinformation an urgent threat to public health. My question to you is, do you agree with that? And what kind of misinformation are we talking about here?
So I think I definitely do agree with that, because I think the most important, the reason for the lack of people taking the vaccinations is probably the misinformation or lack of information thereof of these particular vaccines. So, we've heard various different comments regarding the possibility of use of the vaccines related to infertility or to leading the lack of this particular disease process being prevented from the vaccine series, or a bot being put into your body, etc. All of those things are probably misinformations that are currently available in the social media that unfortunately has led to many of the people not wanting to take a particular type of vaccines. The lack of information on its efficacy or effectiveness against the different variants is yet another misinformation or lack of information that's currently available. Some people say, oh, you take the vaccine, you're still going to die. Or, how well does this vaccine protect you, etc. I think all of those information are still not 100% of times correct or valid in the various social media's messages that keep going around.
Right.
So I think that is the big deal.
Of course, he actually called on these social media platforms and tech companies and has kind of requested them to look through the misinformation so we can get more vaccinated. Doctor, let's talk about this rising cases of COVID-19. Almost 50% of states more than 50% of states are seeing a rise in infections. Some are seeing a huge rise in hospitalizations. Some are seeing a huge rise in deaths. My question to you is, why is this happening at such a rapid rate in some states?
So I think it probably is related to the number of vaccinees or the vaccine status of that particular state, or even just the county, just like small pockets that we have around. I think that really does correlate very nicely to the graph of those who have the rate of vaccines. If you kind of overlap them to the rates of the rise of the vaccine of the disease state, we do definitely see that those patients or those countries and counties that have lower rates of vaccinations tend to have a higher rate of hospitalizations with severe disease. So I think it kind of goes hand in hand with what your current rate of vaccinations is in that particular county or state or hospital area.
Right. Experts are even saying, doctor, that there is a third new wave of coronavirus in some parts of the country. Some of the states that we're seeing really rising cases, and this third new wave is Missouri, Louisiana, Florida, Arkansas, and a few more. My question to you is, how bad can this third wave get? How can it affect vaccinated states?
So I think we would be a little bit protected if we are vaccinated, more so because virtually what we've seen is virtually all of these patients who get admitted to the hospital because of the second or the third rise, the third wave of this disease has been in unvaccinated populations. So hopefully in our vaccinated populations, we're going to see less of that particular steep rise. Are we going to see still some rise? Absolutely. Vaccines are not 100% protective. They're definitely very good in the protection in preventing severe disease, but you could still have mild disease, and you could still have a mild symptomatic or asymptomatic pickup of these particular patients who are vaccinated with this particular disease, but hopefully not to the extent that's going to require you to get into the hospital.
And this variant, doctor, the Delta variant of coronavirus, experts are saying that it's like COVID on steroids. Do you agree with that? And how is that truly affecting the low rates of vaccination as well?
So I think I'm not sure that it's actually COVID on steroids. I think what it is definitely has proven that we've seen in the other countries and states is the fact that it's definitely more contagious. So I think we're seeing a little bit more rise and a more rapid rise based upon the fact that the contagiousness of this particular variant is a little bit higher. It presents like a common cold more so than the severe shortness of breath or a cough that we're kind of or fevers that we kind of expected with the first round of the GI series that we had with the first round of waves. So it presents like a common cold, like a stuffy nose, what you would normally see with just a rhinovirus or regular common colds, but the contagiousness and the possibilities of infecting more people faster is where the issue comes along. So you get to see a much larger cluster of cases from this particular variant rather than the prior ones. So I think that perspective is what's kind of worrisome with the rise in the numbers.
Right. So when looking at these states with low vaccination rates, plus the spread of the Delta variant, my question to you is, what should these local and state governments do in order to raise their awareness on vaccine and actually get more people vaccinated? Because it seems like the responsibility now lies amongst the people that are in the state.
You're absolutely right. I think the responsibility lies amongst us. We as the community are the ones who need to step up to be able to take this particular vaccine, because ultimately it is a global disease and you can't just say, oh, you know what, I won't take it, my other XYZ person's going to take it and will help prevent the spread. But it's the unvaccinated clusters that are actually causing this particular wave to reoccur again. So I think stepping up, stepping forward, taking the vaccine to try and prevent this particular spread is what is going to be the most important way of trying to deal with this. Having ambassadors to who believe in it, who have the right information, who are thought leaders, who are role modelers, I think are the ones who need to step up and kind of give their stories to people to make them understand as to why it is necessary. I think it's important not just for oneself to get the vaccine, it's also important to be able to protect your loved ones around you. I think it's very important message that needs to be told to the community related to the ability to not only prevent your own disease. You may be young, you may be healthy, and nothing may really affect you, or you may not have a negative impact, but maybe your parents living with you, or somebody who's on a cancer treatment, or is an organ transplant person who's got a second life after that organ transplant. Maybe those people who are within your community circle are the ones who are going to be impacted mostly, based upon even a small, strain coming through into that household. So I think not just for you yourself, I think it's for you and your loved ones that you need to really step up and take these vaccines.
Yes, got to protect yourself and people around you. That's the only way. Now I have some questions regarding the vaccines, doctor. Pfizer is saying that the immunity from its vaccine is sort of getting lower, and it is saying that it is now developing a booster shot. Now, when this news came out, FDA and CDC says that Americans currently do not need a booster shot. My question to you is, do we need it? Do we not need it? And if so, when?
So I think the data is still up in the air, whether we do or whether we don't. I think the scientific community is really looking into it and is coming up with new data on a day-to-day basis. I think at this particular day, at this particular time, I would still say that we don't require the boosters yet. What is there to happen down the road is still an unknown. I think scientific research, as we've seen in this last 1.5 years, it's at an amazing pace. It's an amazing pace that you are getting data from. So I think it's just very early to really say whether we have or we need a booster at this point. I think for young, healthy adults, probably not. There may be small nuances that may come along, but again, we really need to see data down the road to be able to predict that. So as of today, you don't need to rush to get a booster, and I think we should be okay with what we have at this point. Most important thing is getting up, getting vaccinated, and completing your vaccine series if you've taken the mRNA vaccines.
That's so true. And let's talk about Johnson & Johnson real quick, doctor. It's being linked to an autoimmune Balani syndrome, and they have actually raised an awareness about it. What insight could you give us in that?
So yes, there is an FDA warning alert that has come up. There were about 100 cases of the Guillain-Barré syndrome, which is basically a weakness that sets in from your toes going up and ascending up. Again, the number of cases that has been identified is only at 100, but there are millions of doses that have been given out. So again, I don't think it should be a problem with taking a J&J vaccine at all. It is something that we need to be aware of, and I think one way I am glad that the FDA has really put up that warning. It just tells us that the FDA are doing their due diligence in keeping safety and making sure it's transparent, making sure that the public knows about each and every nuance that gets reported. I think that has been phenomenal. So safety has always been the key, and being able to be available and be transparent and being put onto particular FDA warning sites, etc. I think it just makes the population and the community more aware, as well as have informed decisions as to when they are taking that medication. There may be certain set of populations who may want to just speak with the provider based upon this particular warning that has been identified, and they may or may not be a candidate for that particular vaccine. But as a general rule, I think that small chance of having that neuropathy is very, 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 very small, and it should not limit anybody from not taking it.
So get the vaccine, whichever one is available, just get the vaccine.
Absolutely right.
Let's talk about vaccine in children, doctor, because there's a lot of confusion, there's a lot of uncertainty. 12 to 17 are approved, but we're hearing the vaccination rates are lower. 2 to 12, we're still waiting. Maybe in September, we'll have some results for it. 6 months to 2, we're also waiting. So how are you looking at this whole process? Are we vaccinating enough children? Following that question, I have to ask you the million-dollar question. What do we do in schools this fall?
So I think the vaccines for the kids are going to catch up. I think we are going to be able to get our 12 and above year olds to get vaccinated over this particular summer period, because I think all the parents are very well aware that taking the vaccine really prevents this particular disease from happening, especially with the Delta variant going around with the contagiousness. All you need is one child to really cause trouble. So I think the rates of vaccinations are definitely going to rise, and I anticipate them to be very well taken up in the upcoming next few months before the school starts. The ages of less than 12, we still do not have that particular vaccine approved. They are looking into it. So again, the scientific trials and communities are looking into that particular patient population for possibility of the vaccine down the road. But during this interim time, September is going to come, and we all are aware that in-person schooling is going to be very important for all our kids. This last year has been difficult for all the children in its own special ways, so we all know that it's not just learning process, it's not just the physical books, etc. It's the actual interaction that's going to be very important, that was lacking this past year. So I think going back to in-person is going to be very important. But having said that, I know the CDC recommends no masking is required indoors, but I think the local jurisdiction is still up to that particular local community and local school district to decide what is apt for them. It is a it's not just a one factor. You really need to know what's happening in your community, in your small, tiny school district community, to see what the rates of the disease are, to be able to have your local jurisdiction, your local school districts be able to make their information available for the parents and the children regarding yes or no masks indoors. So I think that's more to come. It all depends upon what our numbers are going to be in the upcoming few weeks. And then again, it's a very fluid decision-making thing. So, you may have no mask on September 1 and you may have a mask on September 2 or vice versa. So I think it's something that we'll just have to see based upon your local community as to how many cases are around and what is the number of vaccinated kids in that particular in that particular school population, if it's a high school or a middle school where it's ages of 12 and above. But for the elementary, I think it's going to be more related to your local areas in schooling and mayors who make the decisions regarding yes or no for masking. But I think masking overall is going to be important. And I think if you're not vaccinated, I think it's a great idea.
Yeah, definitely. Interestingly enough, New York City is going to require mask in its school. The mayor has come out with it, and even other states are saying that their school administrators are going to decide, if mask and social distancing has to happen. Now, this brings me, I only have 2 more questions left for you. This brings me to another question which has been on everyone's mind, and it's also confusing. Masks in general, doctor. The World Health Organization has said that even fully vaccinated people should wear a mask, especially because of this Delta variant spreading. How are you looking at it? What should be done with the mask mandates?
So I think masking is fantastic. We figured it out last year, but that masking definitely decreases that particular rate of transmission. So I think it's not just you as a person, as I mentioned before also, it's not just you as a person, it's you in that community that you are in, that makes the masks important for you. So if you are standing next to somebody who is immunocompromised, who even though has been vaccinated, may be more at risk of having trouble. And I think trying to protect that particular loved one is just as important. So having a mask on is always your own at your own discretion. It is not required for you to have a mask on, but if you know of somebody who is around you, or if you're unaware of your people around you who are vaccinated or non-vaccinated, etc., staff, I think as a civic duty to prevent this particular disease, having a mask on will really help limit that spread. So I think keeping a mask on is at your own discretion. It is not required, as the CDC mentions, but I think it's at your own discretion. You need to be aware of your ability to get the disease, of your loved ones to be able to get the disease, what your local community risk of the particular infection is, and of course, what are the variants that are kind of flowing around? Is each and every vaccine going to be just as efficacious? We just don't know yet. There's so much that we don't know yet. So I think prevention is always better than cure.
Quick follow-up before I ask you the last question, doctor. South Asians at high risk, we have talked about this before. Should they be wearing masks indoors? How are you looking at that population?
So I think I'm going to still kind of put it in the same chalkboard that I said before regarding, I think Asians definitely were known in this last year and a half that we really did have a significant morbidity associated with this particular disease.
Right.
So I think having a preventative mode of having a mask on board is, I think, ideal. If you're 100% guaranteed that there is just everybody's vaccinated around you, then that's a different story. And you may be a little lax on that, but I think it's probably better to have a mask on, especially if you are unaware of of everybody around you and what the status is.
Yes, definitely. The masks and the vaccines, they are both important right now. My last question to you
Absolutely.
is, Doctor, I would love to know your prediction for the next 2 months. What's going to happen in the nation with COVID?
Well, I think we are unfortunately already seeing quite a few of our states having a rise in the numbers. I would assume it'll be a similar kind of pathway. Hopefully it won't be the way we were before. So I think it would be just a small hump. Delta variants are probably going to be the most common variant that is going to be floating around. We just don't know how much, but the rise is definitely seen pretty much throughout in the different pockets, some pockets more so than the others. But even in New York, New Jersey area, we definitely see a rise in that particular variant. We do anticipate a slight increase in the uptake as we've seen our numbers here in New Jersey's site and the John Hopkins site to kind of just review on those. But, summer's out, people are lax, people are outside, going bonkers, me inclusive. But no, I think we just have to worry about a small tick that's going to happen.
Right. We all have to stay vigilant right now. It's so important. Thank you so much for your time today on ITV Gold.
Absolutely. Thank you very much for having me again.